Thank you, Madam Mayor, councillors. My name's Nick Beaugeard. It's an impossible surname, so that's fine. Look, before I begin, this speech may be triggering for people who have mental health issues or eating disorders. So if you're watching online and you do, press pause. It was a cold, drizzly afternoon during COVID when I took my daughter to the Northern Beaches Emergency Department on a doctor's advice. Over the next several hours, I learned about self-harm, restrictive eating, binging and purging, and got my first introduction to New South Wales mental health system. After over 10 hours in the emergency room, my daughter was admitted to the public mental health ward in the Northern Beaches Hospital. This ward has a locked nurses station enclosed in bulletproof glass, rounded surfaces, and treats patients who are a danger to themselves and others. Despite a special elevator for mental health patients, due to a design flaw, it exits to an open passageway on level 3. My daughter was diagnosed with atypical anorexia, the psychiatric disorder with the highest mortality rate, with 20% of patients not surviving. The hospital urged us to move to the private ward and upgrade our health insurance, which can be done once in a lifetime for your entire family. That costs us $10,000 a year. And the fact my daughter is alive today is due to our ability to pay for top-level health insurance. In the public system, I don't think she would have survived. She was a vulnerable young lady placed in a ward with seriously mentally ill patients, as mentioned in the notice of motion. There are 271,000 people in the Northern Beaches, with approximately 20% under 18. The OECD and the Australian Productivity Commission recommends 50 mental health beds per 100,000 people, which means we'd need at least 25. However, in the whole of the Northern Sydney Health District, there are 12 beds for people under 18. You have a drive round the area, look at all the schools. It's half a kindy class for all of those kids. Our community suffers due to the last state government's decision to privatise everything, removing 2 public hospitals and giving us a private company. We must not just write another strongly worded letter or turn our children's issues into a political football. Council can't fix the hospital or the state health system, but it can help parents like me navigate this very complex system and help facilitate discussions and results for all. Councillors, you're the ones closest to the community. The problem is affecting us directly and we need help. And finally, something that's been comforting to my family, and my daughter's doing quite well now, so just to end that, I'd like to thank Councillor Regan for his ongoing support and advocacy on this matter. It's been very comforting. Thank you.
Thank you. Okay.